Hi, I'm Hayden, a chair yoga instructor for senior citizens, and today we're going to be talking about what's up with your bad back and what you can do about it. Low back pain is by far one of the most common issues people come to me with as a chair yoga instructor for senior citizens. And it's really no surprise because estimates say that somewhere between 20 to 75% of people over the age of 60 suffer from chronic low back pain. This can significantly detract from your independence as an older adult, as well as your overall quality of life. That's why I wanted to make this video outlining the most common causes of low back pain in senior citizens. And as a quick disclaimer before we get into the video, there are lots of medical conditions and specific injuries that can contribute to low back pain in senior citizens. That is not the focus of today's video. Here we'll mostly be outlining some of the general age-related changes in the body as well as postural issues that can contribute to low back pain. This video is not meant to substitute for proper medical advice. Alright, so with that, let's dive into the video. So what are some of the most common age-related changes in the body that can play a role in lower back pain? Well, first, let's understand some basic anatomy about the spine and how it works. I'll put a picture up right here, but essentially, the spine is made up of vertebrae, little bones stacked on top of each other, which surround and protect the spinal cord. And between each of these vertebrae are little discs of cartilage called spinal discs. As we age, our bone density naturally decreases, and the cartilage also starts to wear down in between these discs. That makes your spine more prone to compression fractures, and it makes your discs more prone to things like herniation, which can cause sciatica and other nerve-related pain. Apart from bones, muscles also start to see some change as we get older. They tend to lose strength and flexibility, and these changes in the function and size of our muscles can lead to posture-related issues that contribute to lower back pain and increase the risk of injury. Weak or tight muscles can also lead you to rely more on your joints when you're performing certain movements, which can increase pressure on bones and joints, which are already seeing a lot of wear and tear. The last effect this has is that weaker muscles decrease something called proprioception. That's our ability to know where our body is in space without actually having to look at it. And it plays a huge role in things like balance. So the weaker your muscles are, the harder time you're going to have balancing, and the more at risk you're going to be for falls that could injure your lower back. So what can you do about all this? Well, the bad news is that after about the age of 50, your bone density naturally starts to decrease, and it's really quite hard to build new bone at that point. So your efforts are best spent just trying to maintain what you have the best you can. However, the good news is that seniors can still see significant improvements in muscle strength and flexibility within just a few weeks of increased physical activity. And as an added benefit, resistance training can help maintain your bone density as well. So my personal recommendation is that seniors focus on training for strength, flexibility, mobility, and balance as they get older so they can get the most bang for their buck. As I mentioned before, certain areas of muscle tightness or weakness can lead to poor posture that then contributes to lower back pain. One of the most common of these posture-related issues is pelvic tilt. Let me go ahead and demonstrate so it's easier to understand. And so the pelvis can tilt too far forward or too far backwards. When it tilts forward, our stomach is pressing out, our lower back is arching, okay? And this is called anterior pelvic tilt. When it tilts backwards, our tailbone tucks in, our lower belly is tucking in, okay? And this is called a posterior pelvic tilt. So what are the most common causes of these? Posterior pelvic tilt is most commonly caused by tight hamstrings. These are the muscles that start on the back of your kneecap and run all the way up the back of your leg, and they attach at the bottom of your pelvis. So when they're tight, they're going to pull your pelvis forward like this, and then all the weight of your spine is going to collect right here in your lower back. And that's a lot of pressure for your vertebrae to handle. Now, as far as anterior pelvic tilt goes, the most common cause is tight quads and tight hip flexors. When these are tight, they're going to pull your hips forward like this and create this arch in the lower back, create this anterior pelvic tilt. And if you can try it, you can even feel how much pinching and pressure there is when your lower back is compressed like this. All right, so also not good for the spine. Both anterior and posterior pelvic tilt are perfectly normal positions of the spine to be in occasionally. But if we're spending excessive amounts of time in one or the other, it can create a lot of pressure in the lower back, which is not healthy for our vertebrae or our discs. Apart from pelvic tilt, another really common contributor to lower back pain in seniors is having weak core muscles. Now, a lot of the times when people say core, they think about doing crunches and planks, but our core actually includes not just our abdominals on the front of the body, but also the muscles in your back that help support the spine. Specifically, the spina erecta muscles and the multifidus. These help extend the spine, decreasing pressure in your lower back, and they also help stabilize your vertebrae and prevent injury to your bones or discs in movements like bending, twisting, or leaning over towards the side. In addition to a weak core, limited hip mobility can also be a common contributor to lower back pain in older adults. This is our ability of our hip joint to rotate through its full range of motion. This can lead to poor posture during day-to-day activities, especially such as when you need to lean over and pick something up. As you can see in the demo, I'm bending a lot through my lower back to be able to reach because my hips aren't mobile enough to bend over and squat to pick it up. This is putting a lot of pressure on the lower back and all the joints there. So it's something we really want to work on to be able to avoid injury to the lower back. So last on the list is lateral misalignment of the hips. And I know that sounds kind of complicated and fancy, but really all this means is that your hips are tilted up more to one side than the other. And what this actually does is create a chain of events through the muscles in your legs and lower back that then creates a lot of muscle tightness that's excessive on one side versus the other. And it also puts uneven compression on the vertebrae and discs on one side. So this is a really, really common cause of muscle spasms on one side of the lower back, as well as herniated discs and other causes of sciatica pain. So let's stand up and I'll go ahead and show you the exact chain of events that's causing this. So if you have weak hips, there's a good chance that you're standing like this. This is especially true for the ladies, but this is really not good for your lower back. The reason why is because if you're sitting more over to one side, two muscles are going to become overactivated to help compensate. One is the TFL, which is going to be right here at the top of your hip. And this is going to connect to the IT band, which is a line of fascia or connective tissue that is trailing all the way along the outside of your leg. So these are going to get really tight to try to bring this hip down. The IT band also connects to the QL in your lower back, all right? So this is a muscle right here. And if it's too tight on one side, what it's going to do is cause your hip to compress here. And all the vertebrae, all the discs and the nerves here on this right side are going to be compressed. Now, just the muscle tension from the tightness in the QL can cause pain, but also this uneven compression in the spine can increase the risk of herniated discs, sciatica, and other nerve-related damage. So you really want to make sure that your hips stay nice and even throughout the day. So as a chair yoga instructor, I would be remiss not to talk about some of the specific benefits I think chair yoga can offer for seniors struggling with lower back pain. First on the list is that I find yoga to be a much more well-rounded form of exercise compared to things like strength training, general stretching, or running. Yoga can help improve your strength, your flexibility, your circulation, your mobility, your balance, all in just a 30-minute to 1 hour practice. And on top of that, all of these skills are worked on in an integrated way. Your joints, your muscles, and even your nervous system are all learning how to work together to support your body in different positions and movements in a functional way. Compared to certain isolated strength exercises, which don't typically show up in your day-to-day life? Like, how many times have you had to do a bicep curl in your actual life? Not very often, right? However, you do need to be able to coordinate your joints and your muscles to be able to bend over easily without putting stress on your lower back. So it's more functional in that way. The last thing is that yoga can be extremely customizable, especially if you're working with an experienced teacher. Whether you have specific muscles that you want to work on strengthening or helping stretch, you can customize it to that. Whether you're super fit or more of a novice on your fitness journey, yoga can be customized to meet you where you are. This is especially in comparison to certain forms of exercise that become less and less accessible as you get older. So what are some of the specific chair yoga exercises that you should focus on doing for your lower back pain? First of all, in order to help with that pelvic tilt, we should focus on hamstring stretches, quad stretches, and hip flexor stretches. We also want to focus on strengthening the abdominals. That's both in the front and in the back. We also want to work on our hip mobility and strength, so that way we're able to easily move without a limited range of motion, and so that our hips are strong enough to keep our hips neutral. If you're someone who struggles with lateral misalignment in your hips, it may also be worthwhile to focus on stretching out through the TFL, the IT band, and the QL. And as an honorable mention, twisting movements can also be helpful for people with lower back pain. If you're someone who has sciatica pain or a herniated disc, this might not be the best option for you, and it's totally fine to leave it out of your exercise program. However, for people who are generally healthy, it can be good to help just mobilize and lubricate the spinal joints, as well as build a little bit of core strength through the obliques. If you're interested in the specific chair yoga poses that you can do for your lower back pain, I outline that in my third part of this Low Back Pain in Seniors series, and I go through 10 yoga poses that you can do for your lower back pain. I give visual demonstrations, step-by-step instructions of how to do it, and a few modifications to make it easier or harder if you need that. If you're watching this video in August of 2024, it might not have come out yet, so hang on until the end of the month, but otherwise the link to that video should be in the description here. Did you know that your mindset can also contribute to your lower back pain? Through behavioral changes as well as changes in your brain and your nervous system, your beliefs about your lower back pain can actually perpetuate it and make it more intense. Interested? I talk about that in part 2 of this series, which again, you can find in the description of this video. Thank you so much for taking the time to watch this video. I sincerely hope that you got some value out of it. If you have any questions or clarifications you'd like, please feel free to drop them in the comments section, or you can email me directly at info@haydensyyogapractice.com. Thanks so much again, and have a wonderful rest of your day. Bye-bye.